Today we're going to demonstrate how to measure resting blood pressure and resting heart rate. Measuring heart rate is important because it can determine your fitness level and your cardiovascular health. The average resting heart rate should be between 60 to 80 beats per minute. Athletes or people who are very physically active can have heart rates as low as 40 beats per minute. Here we have Billy, who will demonstrate on our subject Shelby how to measure resting heart rate.
Today we're going to be showing you how to take resting heart rate. Measuring resting heart rate is a good indicator of how cardiovascularly fit an individual is. It can also determine if your exercise program is working for that particular individual. If the program is working, your resting heart rate values should decrease over time due to the improvement of your overall fitness. There are two actual spots on the body where the resting heart rate is appropriate. The first side is on the left side of the body, on your left arm, which would be the radial side of the arm, which would be thumb side. What you can also do, the second side would be the crest of the neck, but for this test, we are going to palpate the radial artery. The first technique that we're going to use is palpate for the pulse by using our middle finger and pointer finger and gently cradling the arm. And once you find the pulse, we're going to go ahead and palpate for it. And once we find the pulse of the radial artery, what we're going to do now is count the beats. The initial beat always starts at 0. So 0, 1, 2, 3, so on and so forth. And what we're going to do now is count the beats for 15 seconds. So we have our stopwatch here, and what we're going to do now is find the pulse and count to 15 seconds. Alrighty, so her pulse for 15 seconds was 15. What we're going to do now is 15 times 4, which would be 60 beats per minute. So that would be a normal heart rate for resting values. You typically don't want to be above 100. That would be tachycardia. So Shelby here is actually doing pretty well for her resting values.
Blood pressure is an indicator of how much force is applied to the arteries as the heart pumps blood. This measurement is read as a ratio. The top number is systolic pressure, which is measured as the heart contracts, and the bottom number is diastolic pressure, which is measured as the heart is filling with blood. Optimum blood pressure is 120/80 or less. High blood pressure can eventually lead to heart attack or stroke. And now Shelby will demonstrate on myself how to take resting blood pressure.
Today I'm going to show you how to take resting blood pressure. The average heart beats between 60 to 80 times a minute while at rest. Your heart's blood pressure is subject to change constantly depending on what you eat, drink, if you are nervous, or exercising, or even your posture. For the average adult, the blood pressure is said to be 120/80. Pre-hypertension is between 120 to 139 over 80 to 89. Your doctor should take several readings before considering someone hypertension or pre-hypertension. Hypertension is 140/90 and higher. Hypotension does not have clear guidelines as hypertension does. The first number is a systolic number, and it is a pressure during the heartbeat, and the second number is a diastolic number, and this number represents the resting between the heartbeats. You want to make sure your patient doesn't have any caffeine or nicotine for at least 30 minutes before taking their blood pressure. Make sure your patient is sitting with their feet flat on the floor, back against a chair, and relaxed as possible. Also, ask the patient not to talk while performing the test. You want your patient to have been sitting for at least 5 minutes with their back supported before you begin the examination. When taking the blood pressure, make sure you take it on the left arm and you can see the gauge and hear the blood pressure. Make sure the patient's arms are supported and relaxed. Place the cuff 1 inch above the crease of the elbow and make sure you place the stethoscope on the brachial artery. When using the stethoscope, the earpieces should be facing forward towards the nose. Center the rubber bladder and the cuff over the brachial artery. Quickly inflate the cuff to 200 millimeters of mercury, and then you want to make sure you release the valve at a rate of 2 to 5 millimeters of mercury per second. The first initial sound you're going to hear is a systolic blood pressure. The diastolic blood pressure is going to be the complete disappearance of sound. Make sure after you take you deflate the cuff completely. Also, you want to make sure you wait at least 1 minute in between readings, and make sure to take at least 2 readings to get a true blood pressure. The readings should be within 5 millimeters of mercury of each other. If not, wait 1 more minute and do another reading. Now I'm going to demonstrate on Susan how to perform resting blood pressure. Susan's reading was 119/79.